Good afternoon, everybody. Hope you've had a wonderful Monday. It's a public holiday for us here in Queensland, Labor Day, so of course that means you don't do any work. Just got back from the Spine Society of Australia annual scientific meeting and the Biomechanics Symposium, so I thought I'd run through a few of the presentations and some of the information that was delivered. So firstly, we got to meet some fantastic professionals who've been studying biomechanics of the spine for their whole careers. Tom Oxland from Canada and H.J. Wilkie, Jan Hockham Wilkie from Ulm, Germany. I got to talk to Professor Wilkie personally and ask him a little bit about his landmark studies following on from those of Narkemsen, investigating intradiscal pressure. So we'll talk a little bit about that. So effectively, this is landmark research that probably wouldn't get ethics approval now. They had a 45-year-old volunteer who, under sterile conditions, surgically implanted a pressure transducer into the L45 disc and then got him to engage in certain postures, and they measured the intradiscal pressure. So this is his slide that he talked about, and I think the main things that we can take away from this slide, I've highlighted the results in yellow and in red and in green on the x-axis there. And for reference, we've got the pressure within your car tyre, which is about 25 to 30 psi, or around 0.25 megapascals. And so you can see in all scenarios the neutral spine or straight spine position of sitting versus sitting and flexed, and then standing, and then standing flexed, and then standing with a 20 kilogram weight, and standing with that same 20 kilogram weight with a flexed spine or intralumbar flexion. So in all scenarios, the intradiscal pressure approximately doubled when intralumbar flexion was exhibited. So that was pretty indisputable in his research. And people might say, well, whoopee-doo, what does that mean? Yes, the pressure goes up, that's pretty indisputable. But what effect does that have on the disc health? Well, the conclusion is now fairly clear that with repetitive cycling of that intralumbar flexion, with repetitive cycling of elevated intradiscal pressure, that accelerates the structural deterioration of the disc. And that's been clearly shown histologically when you examine the discs after they've been put into cyclic robotic machines that recreate those activities of daily living with intralumbar flexion. And so that's the relevance and that's the significance of repetitive accumulative intralumbar flexion, and why it's so important that we talk about minimizing that in our activities of daily living.
Activities, all kind of physiotherapy and manipulations and workout machines and so on. And these numbers here were now used in order to calibrate our machines. Here you don't see only the pressure, which can go up to 2.3 megapascal, that's 10-fold the pressure in your car tire. You can also calculate the Newton, and these numbers can then be used in order to perform, to calibrate your models.
Here's some other interesting results presented by other researchers, whereby simulations of a very specific intralumbar flexion, 13 degrees, with variable amounts of anterior displacement or shear. And of course that becomes quite relevant as discs degenerate, because the annulus fibrosis and the lamellar fibers start to become more redundant and permit more anterior shear. And the results of this are quite impressive in regards to structural deterioration of the disc and disc herniation. So let's have a look at that.
3 millimeters of compression, sitting in a water bath, you can almost hear the crackling of the annular fibers as the nucleus is forced out posterolaterally by the applied compressive displacement there. If we turn the volume up, we get a nice sound there, but that's okay. So there's the evidence. So very reliable creation of herniation in pretty much all of the segments that we had there. The herniations tended to be lateral, posterolateral.
So overall, a fantastic weekend, networking with other researchers who are on the cutting edge of biomechanics research. Of course, we all know biomechanics matters when it comes to joint health, and the spinal joints are no exception. Anyone who doesn't think that is living on another planet. So just ignore them, and let's focus on optimizing the clinical guidelines for back pain rehabilitation. Remember, a lot of these biomechanical engineers are not in clinical practice, so they are not going to be talking about clinical guidelines because they're not clinicians. We need to use their fundamental data and the findings from their biomechanical research and draw that valuable information into clinical practice. And then we can start to improve on the epidemic of back pain. Move well, move a lot, and build great functional capacity, and you won't run into problems with your lumbar spine. And if you convey that message to your patients, they'll also get better as well. All the best. Thanks for listening.